early 2020, the world has experienced a pandemic of COVID disease. At the beginning, we were faced with few therapeutic options by which to treat patients infected with COVID. Mayo Clinic does what it always has done, which is to combine the best science and the best innovation to come up with treatment strategies. A result of that was that Mayo Clinic initiated an expanded access program for Lenzilumab, and the paper that we'll discuss today reports those results. My name is Andrew Badley. I'm a physician scientist in infectious disease at Mayo Clinic.
Hello, my name is Saad Kandarian. I'm a physician scientist at the Mayo Clinic in the Division of Hematology and Assistant Professor of Medicine. My research focused on immune therapy and understanding the mechanisms of toxicities after immune therapy.
Hello, I'm Zami Temesgen, a physician in infectious diseases at Mayo Clinic. I am the principal investigator for the Lenzilumab compassionate use program, as well as the phase 3 clinical trial of Lenzilumab at Mayo Clinic.
Today, we're going to be discussing a paper soon to be published in Mayo Clinic Proceedings entitled GM-CSF Neutralization with Lenzilumab in Severe COVID-19 Pneumonia, a case control study.
Our research team has developed a strategy to target the cytokine GM-CSF to prevent toxicities after immune therapy. We have learned from early biology studies of COVID-19 that following the viral infection, patients develop an immune response that is similar to the cytokine storm that we see with immune therapy. This was the rationale to use Lenzilumab to target GM-CSF and improve the immune response after COVID-19 infection.
Under the compassionate use program, 12 patients with COVID-19 received Lenzilumab at a dose of 600 milligrams intravenously for 3 doses. To provide context to our observations, we established a control cohort of patients who received contemporaneous standard of care at Mayo Clinic. These patients were selected from our registry of COVID-19 patients and were matched for age, gender, and disease severity with the Lenzilumab treated patients. All patients were hospitalized, required oxygen supplementation, but not mechanical ventilation. And the results are as follows. Our primary focus is on clinical improvement, and clinical improvement is defined as at least a 2-point improvement on a clinical ordinal endpoint scale that has been widely used in COVID-19 clinical trials. In our study, the time to clinical improvement was significantly shorter for Lenzilumab treated group compared to the untreated cohort. Similarly, the time to discharge was significantly shorter for Lenzilumab treated patients, a median of 5 days versus 11 days. Additional findings include a faster time to resolution of the acute respiratory distress syndrome in patients who received Lenzilumab, as well as a significant difference in the mean SpO2 FiO2 ratio between the Lenzilumab and the untreated groups over time. More patients died in the control group, but this did not reach statistical significance. When we put the risk of progression to mechanical ventilation and death together, there was a significant difference favoring the Lenzilumab treated group. We had some inflammatory markers and markers of disease severity available for us before and after treatment with Lenzilumab. And these markers were also available for some of the patients in the control group. We were able to show that there was a significant reduction in inflammatory marker C-reactive protein in the Lenzilumab group relative to the control group. Importantly, there was no treatment emergent adverse event attributable to Lenzilumab. In one patient, we had blood samples available pre and post Lenzilumab treatment on which we could do a cytokine analysis. And in this analysis, we were able to show a broad decline in cytokines following Lenzilumab treatment.
As this study was a case-controlled design, it was not intended to be able to discriminate efficacy associated with Lenzilumab use. However, on the basis of the findings that we report, there's a suggestion that Lenzilumab could be of benefit to patients with COVID disease. On the basis of these findings, therefore, a phase 3 clinical trial has been initiated to determine whether or not Lenzilumab has activity and benefit for patients with COVID disease. Thank you for your attention.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.